time now for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Woohoo! Good morning, Dave.
You know what? This show's not nearly long enough. Everything that went on in the healthcare world this week, we could go at this for an hour or two. But we better stick with the flu today because flu is all over the place. And, boy, we had a couple of granddaughters over the Christmas holiday, and they were wiped out with influenza A.
Yes. It is crazy right now how much this is going around. You know, it's going around, but just like everything, there's more to the story, and there's more to do than what I always did over the years with it, which was I tended to always prescribe Tamiflu for that influenza A or B, and, you know, just didn't see that really move the dial for folks very much. It was like, yeah, maybe. And they would just do their tried and true, you know, go get the supportive care, lots of fluids and rest, which that's good. Mm-hmm. But just like I found out during COVID, when I could turn that switch for COVID-19 with ivermectin, wow, that applies to the flu as well and a lot of viral-based illnesses. So it is so much fun right now to be in a space where not only have I found out that ivermectin, we don't have to suffer with these cold symptoms for 2 to 3 weeks and just have it where we're lingering and it's just not getting better. We actually have things that are safe and very effective to get you back on track, right back in the game, so you're not missing tons of time feeling rotten. I mean, I just watch, you know, when you get those flu symptoms, how you just are curled up on the couch and the whole body is just aching, waves of sweat. And when we can go after this in the right way, boom, just like during COVID, many times I'm seeing it's like a light switch. So, and then what I do, Dave, is we implement other really, really good stuff alongside it. I've found that some of the products that work really well, nitric oxide, we've got a really good nitric oxide lozenger here that's fantastic to boost that immune system. And we also have a really amazing vitamin C. It's a sodium ascorbate, and when you up-titrate the dose on that and working towards GI tolerance, so it may be 4 to 5 scoops of that a day that we may recommend for you, that even if you're starting to feel pre-sick, you know, when we lived down in Georgia, our neighbor across the street, his wife would always say, I can always tell when Barry's, he gets grumpy, he's pre-sick, he's pre-sick. And we've all felt that. It's coming on. Guess what? Even some of these things, when you feel it coming on, hit it off at the pass ahead of time with some of this stuff. And you're going to have chances. Dr. McCullough, you know, we carry one of his products that he's gotten behind, Cofix RX, which is like an iodine nasal spray. First sign of symptoms, you know, something you can carry on the airplane, you know, when you're traveling, or you're at, you know, inside public events, you're around a lot of people in the wintertime closer together. These are the things. Then on top of it, transitioning, Dave, into Ozone and vitamin C, both through the IV. You know, I've got a young lady coming in right now that she's had since Thanksgiving, just can't seem to kick it. When I throw in the combination of IV Ozone, IV vitamin C, wow, I am seeing so much incredible things happen when we're just boosting that immune system that way. And I get folks just feeling better a lot faster. We do. Our team is just awesome here, working with some incredible tools. So,
yeah, that's really cool. You know, I've been fortunate enough. I've seen some videos on Ozone. And what's really cool about Okoboji Wellness Clinic is you've got a variety of tools. You're not We've talked about this before. Some of the doctors, they get themselves kind of branded into one form of care, like I do ozone only. I just saw a thing last night I was reading, and this gentleman, I'm not going to give the entire recipe away, but kicked a stage 4 cancer with a couple of medicines plus hyperbarics and red light therapy. And that's something else that you offer from besides ozone and more.
Oh, absolutely. Ozone, hyperbarics, what we try to do is tailor the approach and the therapy that's best for you. So if you're coming in and you're just spinning your wheels with whatever that chronic illness is, we may try going down one path after we sit down, do an hour-long evaluation to get to really to the bare basics of what's going on physiologically with you, why. And then many times, the guest that comes in has a preference because we're going to go over all the different types of treatments available. We're going to let you walk through the clinic and eyeball some of these things. And some folks really have a preference to, they're like, hey, that really sounds interesting to me, and I really think my body's going to respond well to that. And so many times, like during COVID, I was always, let's throw the kitchen sink at things, which was high-dose vitamin D, it was vitamin C, quercetin, many things. That was the kitchen sink approach. So for some people that are not toxic, meaning their drainage pathways are open, some of those folks are coming in and saying, I'm just feeling like I want to throw the kitchen sink. So sometimes we'll do that. Well, it's called biohacking or biostacking, where you can add some of these therapies and put them together, like a hyperbaric, a red light, neurofeedback, which is more of a frequency type of treatment, ozone, which is supercharged oxygen. And other folks will be like, well, I resonate with this one area, and maybe we talk and figure this approach might be the first most effective thing for you. And then we go down that road, and then if we are seeing some improvement, but maybe it's time to change a little bit, we pivot, and then we can try one of these other modalities. But the ozone itself it's kind of confusing. It can be confusing because it's not something that over the years that your primary practitioner talks to you about, because it really wasn't one of those things that was taught to us in medical school. We hear about the ozone in the atmosphere and that kind of thing. If you do a search on ozone, it can be a bit confusing, like a lot of these different holistic treatments, but it is incredibly safe. It's incredibly versatile, so it can be used as an adjunctive therapy. So it's, again, a part of a therapy that I'll use in combination with many other things. So, again, we can't just do one thing in many cases. We have to adjust lifestyle. We have to move our bodies, these kinds of things. But in combination, when ozone in particular, as an example, it's just something that there is becoming a bigger and bigger awareness, especially around our region, tri-state area, about it now, because we've had folks that have been utilizing it and seeing results. And so then they're sharing with their friends, just like they have with the hyperbaric therapy over the course of the last 4 to 5 years. They're seeing results. They're seeing their inflammation go down, their energy go up, their pain levels improving, amongst many, many other areas that folks come in to see us for. And then they come in and we explain it to them, walk them through it. But ultimately, it's 3 oxygen molecules, and we have a machine in the clinic that will create the ozone. And it sits in this little tube where it can stay in that form for about 10 to 15, 30 minutes at most, and then it comes back into the pure form of oxygen. So we have this window, whether or not I'm using that to inject into a joint or into a back or that painful spot in the body. Sometimes I'll go right there utilizing ozone directly underneath the skin and apply that. And or we'll utilize it many other ways through enemas, through bladder insufflation. We've used it for folks that have had UTIs that had a specific antibiotic resistance. One of my nurse's moms actually was told she had an antibiotic-resisted UTI or urinary tract infection, and she did a bladder insufflation with ozone, put ozone up into the bladder, and within 1 to 2 treatments, knocked it out. And we didn't even need to have antibiotics, which was a good thing because it was an antibiotic-resistant case. But this ozone, it's supercharged in the body. If you think of it that way, it's making your ATP production more efficient. It boosts your immune system. It decreases inflammation or cytokines. It increases oxygenation to the tissue. So it's kind of funny. I'll come into the room if I'm going to do an injection with ozone, and I've got a tube that's held upside down because it's more dense than just regular air. So it sits in there with no cap on it, and it looks like I've just got nothing in there. And then the surprising part is, especially with a prolozone injection, which is for the pains, that's a little bit of a vitamin mix that I'll put in first, and then I'll put in that ozone gas. And then it turns into what's called lipid peroxidases. And then that's where all the ozone magic, so to speak, happens, or it's pathophysiology. There's chemistry, little chemistry behind this, but it turns into these lipid peroxidases, and it stokes this electron transport chain in the mitochondria, which we all were blessed from our moms. Some of us have healthier mitochondria than others, but for those of us that don't have very healthy mitochondria, when we stoke that flame with ozone, that perks that mitochondria up. That electron moves along that electron transport chain much more efficiently, and we start seeing folks that came in saying, "Oh, I'm just been dragging. I've just no energy. I'm inflamed. I've got pain, and anywhere from 3 to 5 treatments." And where they start to notice a change. Or in the case of, like we started off with the flu, those acute infections, again, why suffer an extended period of time if you can come in and do a few treatments, IV treatments, and maybe do some vitamin C, nitric oxide, some other suggestions that we have here, or even a prescription of ivermectin that we can get you on the road feeling better faster.
Yeah, and real quick here before I let you go, ozone, you talked about how you can do that from an IV standpoint, but you also directly, for those that are suffering from knee pain or back pain, you can give somebody a shot directly or near their source of pain and go directly at it. Correctly.
The ozone finds. I always share with our guests that I'm working to find the dartboard, and with I don't have to hit a bullseye, so it's just a real quick, easy procedure in the room, 3 to 5 minutes at most, many times. And I identify on the back. I mark on the back with a pen, a purple marker, a skin marker. Then we will position the individual and put in that vitamin combination first, after an alcohol swab on there to make things nice and clean. And then you follow it up with the gas, and so you don't have to be extremely precise, because that ozone will just find where it needs to go. So I have some folks that come in with sciatica, for instance, which is a lot of times pain that goes from the back down the leg. Mm-hmm. And when I do that injection in the back, the low back, they'll feel it for the next 2 to 3 minutes, kind of track down that sciatic nerve, go down their leg.
Wow.
And so I can tell it's going where it needs to go. The knee, and another example, I had somebody that was saying, I want to see if I can put off a partial knee replacement or a knee replacement for as long as I can. And we're doing that with her right now into her second series. After one injection, she already saw, I think she said 40 to 50% improvement. Now, some folks after that first one for a knee, it depends on how severe the pathology of the knee is. If it's bone on bone, it may take a lot longer to see if we're going to see improvement on that. But if you've got joint space left in there still and just some inflammation, you might not need as many injections to reach your maximum improvement. And in some cases, I would say about 90 to 95% of the cases that I work with on joints and backs and shoulders, I'm seeing close to near resolution in the pain, which that's pretty phenomenal. And then occasionally folks might need to come in for a boost, once in a while, which might be annually, once a year, that kind of thing. But it's just a great option, again, for other folks that are poor surgical candidates. Why not try to do everything that we can to oxygenate that tissue, do everything to support that tissue to help the healing process? So, maybe we can put off a surgery for a while or permanently avoid it in some cases. Again, even carpal tunnels, doing a wrist injection or hand pain. I've been finding it's been incredible helpful for folks with thumb arthritis, hand arthritis, where I'll just go either right into the joint of the metacarpal bone there, or I will go into the web space in the hands, put a little of the numbing medicine in there, and it is just mind-blowing how well that works to give people quality again, so they don't have the puffy hands, or they can grip again, they can open a jar, those kinds of things. So again, extremely powerful tool, like many of the tools that we have here, and versatile, and in the sense that you can use it for, like we talked about some of the acute stuff with an acute infection, whether it's the flu or something long term like pain, or somebody that's got autoimmune rheumatoid arthritis or joint pain, injecting it that way versus the IV. So it's exciting, and I think you're going to hear more and more folks moving towards adding that to their practices, and also seeking it out and asking for it.
Well, I think that's the thing. I think people are seeking it out. Gotta go. I want folks in this new year to thrive, not just survive. That's what you do at the Okoboji Wellness Clinic. So, to visit with you, to have a discovery call, or maybe they just want to come in and have a shot of ozone in the knee, whatever the case might be, what's the best way to get a hold of you?
Yes, give us a call for a complimentary 15-minute discovery call at 712-339-6024. You can do that with other members of the team. Molly Avery, she's our functional nutritionist. She is a functional holistic guru. And she would do a discovery call. Same with Michael Sheridan, that does reflexive brain work, orthopedic massage, works on the brain to help the body in the healing process. They also take discovery calls, complimentary. And if you just want to call to set up an appointment to get going, again, same number, 712-339-6024. We are off Highway 71 in Spirit Lake, Iowa, right next to Ace Hardware, real easy to find. And we are looking forward to seeing your beautiful faces and get you started on feeling better. I just love it when we have folks that are coming from far and near that get to come. It's like a family experience that we get to start on that journey of healing together. And like you said, thriving, not just surviving. We all here have a big heart for helping people feel better in a way that is sometimes, like we say, inside the box, and sometimes outside the box. But we want to get there in a safe manner, an effective manner, and we want results. Very
good. Dr. Meyer, it's always such a pleasure. Have a great, great day, and we'll chat again soon.
All right. Take care.
Thank you, Doctor.
Bye-bye, everybody.
Dr. Bradley Meyer of the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.